cities with the best of hotels, good connectivity, infrastructure, clean drinking water and food from across the world, there's one thing perhaps that you do not have the best of: the air that you breathe. Air pollution is slowly killing us, and now it's threatening the lives of our children earlier as well. A new study has revealed that air pollution is leading to a substantial rise in mortality risk in all age groups, particularly in a 119% mortality risk among children in 1 to 5 years of age and 104% in infants up to 1 year. Before I introduce my guests, take a look at this report. Air pollution is killing us. It's a wake-up call for the government after a new study shows that air pollution in India poses a significant threat to the lives of Indians. A study by Mumbai-based International Institute for Population Sciences and other institutions states that pollution is leading to a rise in mortality risk in all age groups. One of the most startling revelations in the study is a 119% mortality risk among children between 1 to 5 years of age, 104% in infants up to 1 year, 86% in newborns less than 30 days old, and 13% in adults. The main people affected are in the districts where pollutant PM 2.5 levels are exceeding the acceptable limit under the National Ambient Air Quality Standard. Higher mortality risk in several big cities like Delhi, Mumbai, Nagpur, Kolkata, Patna, Ranchi and Ahmedabad has been observed. The study also says that the interaction between elevated PM 2.5 levels and household air pollution further amplifies mortality risks. Bureau Report, Mirror Now. My colleague Nikhil spoke with some people in the national capital about their take on air pollution. Take a look.
In just few days from now, the pollution levels are going to increase in part of the capital city, and the major reason for the same is attributed to the stubble burning, which is usually witnessed in part of the northern India. Just ahead of that particular season of the stubble burning and the rising air pollution, there comes a study from the side of the Mumbai-based International Institute of Population Sciences, which shows the air pollution pose a significant threat to the human life, leading to a substantial rise in the mortality rate among all the age groups. And this because the critical pollutant level of 2.5 are exceeding the acceptable limit. So this is something which is very much concerning, given that in just few days from now, in fact in a month or two, the pollution levels are clearly going to increase, and the major impact is usually seen in the NCR region, although the study says that there are some of these cities which have been highlighted by the researchers, which says that Mumbai, Nagpur, Ahmedabad, Patna, Ranchi and Delhi, these are the cities which have seen the highest number of pollution in last few days.
Government को कुछ strict actions लेने चाहिए इसके through, उसको decompose करने के लिए action करने के लिए budgets निकालने चाहिए, but हमारी government ही इसमें कुछ नहीं कर रही है, ना उधर की state government ना center government.
ये प्रॉब्लम तो काफी बहुत सारे सालों से है. हर साल हम देखते हैं दिल्ली में अक्टूबर नवंबर सर्दियां आती हैं, हमेशा का है ये कोई एक पर्टिकुलर ईयर का नहीं है, ये चलता आ रहा है. तो गवर्नमेंट, कोई भी गवर्नमेंट इस पे कुछ करने को कभी रेडी नहीं होती. जब भी पॉल्यूशन जाता है, कुछ चीजें होती हैं, फिर वो वैसे ही, मतलब इसका लॉन्ग टर्म इलाज नहीं है अभी तक.
All right, on the broadcast, I'm joined by Bhavreen Kandhari. She's an environmentalist and member of My Right to Breathe. I'm also joined by Dr. Sandeep Nayyar, Principal Director and Head, Respiratory Department, BLK Max Super Speciality Hospital in the National Capital. Good evening and namaskar to both of you. Bhavreen, let me start with you. It is so sad and it is so concerning that every year, this is the same concern that Delhiites have, that people living in urban cities have, that of air pollution. Despite all the outrage and discussions that we have, nothing has changed.
Yes, absolutely. I mean, thank you for even elaborating the report so well. I mean, I don't even need to say anything. You've said it so well. The biggest problem here, which we've been saying also on your shows and various other media, etc., for years now, that this is a terrible state of denial. Now, in spite of the fact that we know that air pollution is a public health emergency, even the Supreme Court has said it, and the ministry will say that. Even recently during the budget session in July, the Environment Ministry, in the response to one of the questions that was asked, on the mortality rate being compared to air pollution, they absolutely denied that, and they said there's no conclusive data available to establish, any such, Now, see, coming to this now, before this also, this is not like the first study. There have been innumerable studies that we've discussed even here, on this panel. But the problem is that until the intent is not there, they're not willing to understand it. Now, how worse can it get? As a mother, I speak here and speak for all the other mothers who are actually now fighting for air, clean air and fighting, to get rid of this air pollution. So it's terrible to think that even that 1 year old, the newborn baby, and even before that, when the mother conceives the embryo, it gets affected by air pollution. And these are horrific figures. They are horrific statistics. Why shouldn't it affect everyone? Because a politician, it's even a bureaucrat. Everyone is a parent or a grandparent. It should affect everybody. Why are we in this denial mode? We should all accept and work on it. So first, I think that step is very important. And then, of course, like in policy sense, again, it's been over 2 years. The WHO guidelines that needed to be updated haven't been updated. So again, it's a way of kind of, it's kind of lying to ourselves, because when we are saying, okay, now the air is moderate today, once these the guidelines are updated, it will not be moderate. It will be probably poor or something worse.
So, Bhaveen, I'm going to come to this a bit later. Let me also get in Dr. Nair into this discussion, into this conversation that we are having. Dr. Nair, one of the most startling revelations of this study has been the fact that infants, our children, are now getting affected. A 119% mortality risk in our infants, in children who are between 1 and 4. What's the kind of situation that you see, with pregnant women, with mothers coming in, getting their babies? How alarming is this situation?
Very alarming, man. Bhavin has picked up very important points, and I will just dwell on these points, and I talk about my experience also. See, each and every age group is affected. It's not only the children. Each and every age group is affected. Only the extremes are more vulnerable because they have a low immunity, and the children are yet to develop their immunity, so to fight with the pollution or other illnesses. So they are more, not only vulnerable, they're more, they succumb to these problems a lot. So I'm more worried about the children because they're yet to see the future, and they are already suffering from the problems. This later on will definitely manifest in number of respiratory ailments and other ailments also, and we see a lot of increase in asthmatic patients or other problems in these patients, even the cardiac patient, even the respiratory, even the abdominal problems. So all these problems, each and every part of the body can be affected. Each and every age group can be affected, and we are now seeing number of health-related problems, pollution-related problems, this sudden surge in it, and it happens every part of the year, especially in this part of the time when say about September, October, and later on in December. There will sudden stubble burning. There will be smog and affecting us. So nothing has been done. Unfortunately, nothing has been done for past so many years. Yeah. We've been discussing it for years to years together. The government comes and goes, new government is formed, but still the problem remains there.
Yes. The fact that there will be smog, we have the autumn season coming in, then the winter season, there will be concerns, there will be, as you said, stubble burning. Of course, there are natural conditions as well where the western winds are not blowing, so the air is stagnant. But those are natural reasons, Bhaveen. The fact that this report also talks about how in households who do not have a separate kitchen space, the study found there are higher chances of deaths among the newborn and adults there. That is a huge concern.
Absolutely. The indoor air pollution is another whole chapter and something that we are not even speaking about. And that is the reason the clean cooking was, extremely important. The clean cooking, which is makes it a better, because obviously when you're burning biomass, many studies have shown clearly how it affects not only the person who's cooking, which could be the mother or anyone else, but the whole family. Because, like you said, the rooms are so small, there is no ventilation. They're cooking, they're sleeping in the same room, and again, the children are the most vulnerable because their lungs are not developed and they're always nearer the ground, etc. So those factors make them extremely, vulnerable to air pollution. And it's doctor just said that a few narratives that we think that air pollution is only about lungs. It's not only about lungs. It's about everything from the top of the head to the toe. It's affecting everything. And there are hundreds of studies that have shown, from Alzheimer's to depression to anxiety to cardiac arrest to everything that you can name is related to air pollution. So there is no question of now saying there are no studies or there's no connect between these diseases or air pollution or death and air pollution. It's very, very clear. And unless you want to be in denial, that's another aspect. And the other is that, like you said, also, it's not about Delhi NCR. Air pollution is now spread its wings in most of the cities and even the rural areas. That is one narrative that needs to be changed, and one has to think beyond Delhi NCR. And also that air pollution comes only in the winter months.
Also understand from you, is there a stark difference between rural and urban areas?
Yes, of course, because every region has its own chemistry. It has its own ways, the own housing. So also, if you're talking of indoor air pollution, if you're talking about the ambient, then also, even if you talk about Delhi NCR, you compare south of Delhi or central Delhi to somewhere in Dwarka, and it's a big difference because tree cover is different, the number of vehicles is different. There could be another place which is now in Sukhdev Vihar and New Friends Colony is facing a waste to energy plant, so they have so much more pollution coming from there. So every region has its own chemistry, and that is why every source of emission that is critical in a certain area has to be dealt with separately. You cannot have like one formula going for every city, every colony, every state. It doesn't work like that. It has to be worked according to the science, according to what's being said, and the sources of emissions is what needs to be worked on. No, we waste so many years in these ridiculous solutions like smog towers, etc. That's not to help. It is the sources. We saw the COVID, how it cleared the air and the skies and the water because the emissions were gone. And it is the emissions will have to be curbed. They'll have to be, when you have these various compliances, they need to be ensured, that they're implemented, enforced, which is a big challenge, as you and I know. So those are the things that have to be brought in, implemented in letter and spirit. Everybody has to feel for it. Everyone has to think that a child in Delhi is going to live 12 years lesser than another child.
I think everybody has that awareness now. Everybody is talking about it, but perhaps the implementation part of it at the individual level is the problematic part, because we have a life of convenience in urban areas. We live in cities, we've got everything at our disposal, and that's probably why we don't want to take up the task of reducing our convenience, reducing our usage of resources. But Dr. Nair, talking about indoor pollution, there are people who don't have any other option. They have financial constraints, they have certain compulsions that force them to stay in that sort of a condition. Is there any way in which we can reduce that indoor pollution and, prevent ourselves from getting severely harmed from, for example, spaces have no kitchens, separate kitchen space?
So I must compliment you picking up this portion, because we're always talking about outdoor pollution, but we hardly talk about indoor pollution. And actually we see that indoor pollution is more harmful because we're spending most of the time indoors, many of us. And the Ramin really picked up about kitchen, and we know now COPD, which used to be a smoker's disease, has we've seen more among the chula smokers in the villages. The other thing which I want to give importance is not only kitchen, even the where you have a worship place. A one incense stick which we burn it out is equivalent to 5 cigarettes we are smoking. So now what has happened now, like you rightly said, that ventilation is gone. That big bungalows have been converted into small apartments, and you have a small घर where you're burning an incense stick or a dhoop or a agarbatti, whatever, and the amount of pollution that is creating is a very, very harmful. And many a time you will see mother or an auntie or a granny will be carrying a child and they will be doing that. So that is again harming the child. And a simple Mr. Coin, which we burn it overnight, will cause a pollution. So I always tell them to curb the indoor pollution is very important. Have a good ventilation definitely, and definitely try to cut down as much as is possible. That is incense stick, that is mosquito coil, or even the dhoop or agarbattis and everything, because they are definitely something which has caused a lot of pollution. Of course, there are some people that talk about keeping our purifier and all, but again, that again are challenging because you just go and pick a tiny purifier, you keep it, which is not recommended for that particular area. It may be recommended for a smaller area. You keep it in a big hall. So things that don't take it into account, and you keep it a purifier. And then most of the people like you and me are always working outside. How much purifier is going to help when we are not at home that time? So I think many things have to be done from us, from our individual level as well as the government level.
Bhavreen, and therefore my last question to you, should we have any sort of expectation from global bodies to come up with some sort of solution? Bhavreen, are you able to hear me?
Is that for me? Sorry, I didn't realize.
Yes, Bhavreen, please go ahead.
Yeah, so solutions, like I said, was very extremely important to work on the sources of emissions. Every like we are getting the clean energy, we have to kind of make it more rigorous. It has to be subsidized. You cannot the government cannot say things and make posters and show data, but not do it on the ground. If you're talking of clean cooking, I think the solar initiative is fantastic from the government, but it must now reach subsidies, to the people who are actually burning biomass, and they will not even have to come to LPG and like Pradhan Mantri Ujjwala Yojana, which is one of the very successful programs again. So that needs to reach out to every household probably, and so all the things have to be more rigorous. We don't need anything, global coming. Everything is known. Everything is here. We know it. The sources of emissions will have to be worked on. The compliances will have to be made. They have to be strict. You cannot allow, thermal power plants to, function and expect citizens to give up their vehicles. It's not going to work like that. It has to be everything. Every source of pollution right now is toxicity for our children.
So I think, Bhavreen, the long-term solutions are several, but the implementation, the implementation is probably which is what is required, a better implementation of all these measures. But I'll have to leave it there. Dr. Nair and Bhavreen, thank you very much to both of you for joining us on the broadcast and helping us understand this entire situation.